Now we're going to do some IMS treatment, which stands for intramuscular stimulation. This is very different from traditional acupuncture. Actually, it has a lot of Western medical theory behind the treatment. The only common thing we do is using the acupuncture needle. The theory behind that is usually most of the time when we have some nerve compression usually is due to some degenerative changes of the spine. And when the joint of the vertebrae compresses, the nerve that exits the body, the nerve actually supplies our muscle, supplies our sensors, but it also supplies our autonomic system, which actually is some innervation into the skin, which we have touch, which we have temperature control by the vascular system, and also we have supply into the pilomotor, we have the goosebumps and the hair standing up. So those are usually under involuntary control. So in this particular patient, when we look at the skin, there are some area that we actually see these more exaggerated pore area, which we call peau d'orange, or kind of like an orange peel. So when I squish in this area, you can almost see it bunches up like the orange peel skin, and which we talk about the autonomic system with the exaggerated goosebumps. So the theory is that if the nerve down there is being compressed, usually we have these erector spinae muscle, which are two big pillars around our spine. If they are spastic, they're going to compress the vertebrae, which will compress the nerve. When the nerve gets compressed, they have some presentation we call supersensitivity, meaning the muscle that it's being innervated, meaning that's where the level of the spine where the nerve goes to the muscle might behave by, first of all, being more crampy. So it creates a lot more spasm, which we call hypertonicity, or which is called Charlie horse for short. And that's the first presentation. So when we'll feel the muscle is very ropey. Now the second presentation was the peau d'orange that I was talking about. So we actually get some changes when we touch it. But we also could feel the temperature of the skin. Some of the area might appear to be warmer or colder, so we know the blood vessel has been affected. And if we do a different test, we could do a matchstick test. If we stick the skin for a while, you can see an indentation. So that means that locally the area has trouble. So in IMS, what we're going to do is use the flexible acupuncture needle to stimulate the hypertonic muscle, the spastic muscle, which will create a local relaxation of the muscle to relieve the patient's sensation of that constant muscle cramp that doesn't go. And that's coming from a neurological perspective, so you could actually get a relaxation internally. That's which is number one. Number two is if we could decrease this muscle hypertonicity, which is compressing on the nerve level, you will also reduce this input of the nerve into the spine, which will actually help to resolve some of the nerve dysfunction that we talked about. So the IMS treatment is accumulative. As we do more sessions, it will relax the muscle, hopefully returning to normal state, so it's not too spastic, but also it will reduce and make the super sensitive nerve calm down. So now we're going to pick a few spots to do, and we're going to do the technique right now. So the key is to know your anatomy and know your nerve innervation, but also very importantly to use your hands to palpate for the tight spot. So we could call them trigger point if you like. There's a certain spot in the muscle that you actually feel most tension. So if we could stimulate that point, we'll create the best relaxation. So here we're going to just clean the skin a bit, and we're going to come to this particular spot. We're going to take the needle, we're going to do a little puncture through the skin, and then we're going to insert the needle. So as I insert the needle, I'm going to feel for the texture of the resistance, which you can see the patient had a little jump. And it's an involuntary reaction, but basically that means the muscle created a reflex that has a little twitch. So we're going to leave the needle in there to give it some time for the body to relax. And usually the patient will feel that crampy kind of feeling is actually starting to subside. Then we're going to just wait for it to happen. And then we're going to either take the needle out or move to a slightly different spot in this particular position, because I could still feel there's a little bit muscle tension. So I'm going to go in again, which this time I do not get a big jump for it, because the first reflex contraction is already starting to relax the muscle. So I'm going to take the needle out. So that's basically what IMS does, except now we're going to screen for the whole back here. So we're going to go to another spot. Okay, this time I'm going to choose on the opposite side here, where I feel has most tension. We're going to an insertion, and we're going to do a penetration. Okay, so as I insert the needle, we actually go into about 4 layers of muscle. The top layer actually did not feel that spastic to me, but when I got to the deeper part, I actually feel a bit of resistance. However, at this point, we did not get a big contraction like we did with the first spot. So I'm going to just move the needle a bit. There we go. We created that. So it doesn't necessarily have to get a reflexive contraction like that, but however, when that happens, we know that's really going to create some neurological influence to relax the muscle, but also to help with that nerve dysfunction that we talked about. So we're going to wait for a little bit. And if I pull on the needle a bit, if the muscle is still a little bit crampy or spastic, it will give me resistance. But at this point, it just feels like it's ready to come out. And that's basically what we do.